is here from our television department. He's producing our broadcasting, sent it down to Troy Shaw, who's downstairs in our studio. We have American Sign Language interpreter who's providing the inserted image, and also in our studio is a Spanish language interpreter who's doing a live translation recording that we're going to incorporate into a full Spanish version of the entire press conference that will be airing later on our Waco City cable channel and a live stream today at 4:30. So you can see you're doing all we can to social distancing, and we're also doing everything we can to touch every part of our population. To provide the information to our Spanish audience, I would like to ask City Councilman for District 2, Hector Sabito, who is on our virtual conference right now, and I'd like him to invite our Spanish-speaking audience to tune in this afternoon. So, Councilman Sabito, please.
Thank you, Larry. Buenas tardes. Para ayudar a nuestros ciudadanos que hablan español a comprender lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español durante esta conferencia de prensa. La grabación completa en español reemplazará la grabación en inglés en el video, y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Thank you.
Thank you, Councilman Sabito. Joining us today, like last time, but this time virtually, to speak on current issues is our Waco Mayor, Kyle Deaver, McLennan County Judge Scott Felton, and Dr. Jackson Griggs, who is President and CEO of the Family Health Center and Vice Chair of the Waco-McLennan County Public Health District. Welcome, gentlemen. Thank you for being here.
Thank you, Larry.
Let me outline briefly what the way we'll conduct the press conference. I'll ask each of you to make an individual opening comment. Then I'll read questions that we've gathered from across the community and that are quite frankly on people's minds. Following those questions, we'll then open it to questions from the media. We have 4 media representatives on the telephone here. We have those there, and they're keeping muted until the mayor will ask them my name to provide their questions. So we'll try to do at least a couple of rounds on that question and answer part. So we're ready to get started. So let's hear first from our mayor, Kyle Deaver, followed by Judge Felton, then by Dr. Griggs.
Thank you, Larry. Good afternoon, everyone. Really appreciate you tuning in for the information that we're going to give today. First, I want to say thank you to all of you in Waco and McLennan County for continuing to stay at home as much as possible and observe distancing protocols. When we started this, McLennan County had one of the highest rates per capita of any of the more populated counties in our state. After 4 weeks of carefully following the shelter-in-place orders, you and we have only 80 confirmed cases in McLennan County. We have one of the lowest per capita rates in the state. Now, the governor announced last Friday that he will open all non-essential retail businesses for curbside and delivery only beginning Friday, to the extent that those entities are able to do that. He said he will announce next steps next Monday on the 27th. And he said that he would take a phased, careful approach to this, which is very important, because if we're not very careful, we will risk a resurgence of the pandemic and defeat all the great work that has been done to this point and all the sacrifice that has been made. If that happens, we would expect to have additional waves of infection, and we're going to have to be monitoring this situation very carefully. We have seen this already in places like Singapore and Japan and other countries around the world, and we've just got to all watch that situation very carefully as we begin to, in a very careful, phased way, lift out of this shelter in place. But thank you for all that you've done so far. At this point, I'll turn it over to Judge Felton.
Good afternoon. Thank you, Mayor. Well, first of all, I want to say that our hearts go out to the family members and friends of those who lost their battle with the COVID-19 virus here in McLennan County. And our prayers go out to those who are suffering with the virus at this time. We wish them a speedy recovery. We're very thankful for all those that are back on their feet and after contracting the virus and are well and up and going again. We have a tremendous amount of gratitude that is owed to all those who have acted responsible and the shelter-in-place order that was issued several weeks back. No doubt this has limited the impact on our community and especially to our hospitals and medical as well. But nevertheless, we have made great sacrifices at our work and at our homes. This is especially true for families that have that are tasked with homeschooling, as well as those that are doing that along with working from home. A lot of companies have gone to a lot of management changes and things that maybe aren't as productive as they normally would due to the restrictions of sheltering in place. For some people, the term home cooking has become a negative word. Our most vulnerable populations have probably suffered the most from this, and in those populations, one that we haven't really spoke much about before in these conferences is our folks with mental health illnesses and that are in distress. This brings out and magnifies those weaknesses within our community and those illnesses that are there as well. And talking to the MHMR folks here in our county, they've had a 20% increase in activity in the last 2 weeks, and no doubt this will continue to grow as long as we're in this mode that we're in right now. So I know that MHMR is adding additional people to handle this. One thing that we want to try to prevent from happening is our mental health populations to start moving into our emergency rooms, which happens many times, and we have to, those are precious spaces that we have to protect and the best we can. You know, lastly, we know that changes are coming, and you know, we hope that they're all for the best, but it's all on our backs to make sure it works properly. We have a lot of responsibility individually in making sure the changes that we make are good changes and we don't reverse back into the same situation that we've been in. So learn all the safety measures that you can to learn how to live safely in a pandemic issue that we are type issues that we have right now, and stay steadfast and keep the faith, and I feel like we'll come out of this as a winner. Thank you.
Well, first, Judge Felton, Mayor Deaver, thank you for the opportunity to join you again today. I appreciate it very much. And I'll start with numbers. Worldwide, there have been 2.6 million cases of novel coronavirus, accounting for 180,000 deaths to date. In the United States, per the CDC, there have been over 800,000 cases and 44,575 deaths. The State Department, the Texas Department of State Health Services has reported 21,000 confirmed cases in Texas and 540 deaths to date. And now updates for McLennan County. And these are updates as of this afternoon. There are 3 new confirmed cases of novel coronavirus. That brings us to a total of 81 confirmed cases in McLennan County. There are currently 15 active cases. 2 of those active cases are currently hospitalized, but neither of those are in critical condition. We have 62 who have recovered, and we have had 4 deaths. The total tests performed as of midnight last night by Family Health Center and the 2 hospital systems, both inside the hospital, the ER, and then in their outpatient clinics, is a total of 2,394 tested. So that puts the positive rate about 3.6%. The hospitals still maintain adequate capacity in case of a surge. There are no known cases that have occurred in nursing homes. There are no new cases among first responders. There are no cases in the jail. And the health district is monitoring 62 individuals. And since we've brought up this monitoring before, I thought it would be a good opportunity to share what that monitoring means. Contact tracing is defined as identifying contacts of confirmed cases. So when we talk about monitoring, the health district investigates all laboratory confirmed cases and collects the following information: demographic information on those confirmed cases, the date of the onset of symptoms and the type of symptoms that the individual has, their exposure. In other words, did they travel to an area of high density, or were they exposed to someone who they knew had a confirmed case? Or is it an unknown exposure? Pertaining to the contact tracing, the health district asks that everyone who's a confirmed positive case list all the close contacts from 48 hours before the symptom onset to the date of investigation, all the close contacts, their household contacts, workplace contacts, friends and family, so that they know who might be at risk of having having the virus. The health district then gives written and verbal instructions on isolation for the person who is confirmed positive, and quarantine instructions for all the household members and other close contacts. Health district calls every person with a confirmed case every day until the individual meets CDC criteria for discontinuation of isolation. They call the close contacts for 14 days every day until 14 days following the last exposure to the confirmed case. So that's a lot of phone calls and a lot of checking in on people, but I wanted to share the good work that our health district is doing under the leadership of Dr. Gray, Betty Shaw, who's the senior epidemiologist. Currently, they're monitoring 62 individuals, and they have to date monitored a total of 168 individuals. Their capacity right now, there are 3 epidemiologists capable of conducting these preliminary case investigations, but then they can use additional staff for the daily monitoring. Currently, 8 health district staff members are monitoring cases and contacts, and this capacity can increase to about 25 more individuals doing daily monitoring. So there's some stretch capacity within the health district in case counts increase. Now we've talked some about the numbers and some about monitoring. I also wanted to mention projections for the state of Texas and maybe a little bit of extrapolated projections for McLennan County. So there's good news here. The current projected peak in terms of deaths per day in Texas was last week on April 16th at 39 deaths per day. So it looks like in the state of Texas, we have passed the peak number of deaths per day. The projected peak for hospital demand for Texas is now at about 1,453 across the state of Texas, and that's currently right now we're in that period of peak in terms of hospital demand across Texas. And again, we are not predicting that we are going to exceed our local hospital capacity during this first wave. And if you're listening carefully, you heard me say this first wave, because I do think that while this initial surge that we've been talking about and worrying about, we are on just the beginning of the decrease on that curve, we do need to begin to think about this virus in terms of ebbs and flows, as opposed to one big surge and then being in the clear. And that's all I have for my initial remarks.
Thank you all, gentlemen. All right, let's move to the question phase. We've got a number of questions that have all been presented by various media, individuals throughout the community. I've come up with a few, and just throughout the health district as well. So we kick right off. You all jump in and however you want to distribute the answer. Today marks 3 months since the first COVID-19 test was given in McLennan County. Given the length of time since then, coupled with the lack of robust testing system locally, how realistic is it to expect shelter-in-place orders to be lifted in May?
Judge Felton, would you take that to begin with?
Sure. Well, as you know, the governor has taken the lead in the declaration of emergency in his orders that have placed the shelter in place across the state. We expect the governor to be making moves off of that order starting next Monday, the 27th. And so it could be that here locally we have a little control about how that happens. But we will be able to counsel and advise local businesses how to best make that work, where we don't have the backlash of the virus coming back on us and us having to reverse some of those orders locally. So, Mayor, you may have other thoughts on that.
No, I agree with you, Judge. I think it's unclear right now how much local control we will have as we move into this easing. But I was very pleased to hear the governor say, as I said earlier, that he was going to do this in a carefully phased manner. That seems to be lining up with the message that President Trump and Dr. Fauci and Dr. Birx laid out at the national level. So as long as we follow that kind of approach, I think we've got a reasonable chance of coming through this.
Okay, next question. If you're planning to lift those orders in May, what number of tests do you have in mind that would provide a level of comfort in doing so? And following up, is that a raw number or a percentage of the population?
Dr. Griggs, would you try to answer that, please?
Sure, and there's widespread experimentation going on right now because we don't know what the right answer is, and each community is sort of its own laboratory right now. We're trying to learn from other communities and reference the experts, but there is no exact or perfect number on what number of tests do we need to be doing. So to share with you what guidance we've received, Scott Gottlieb is at the American Enterprise Institute. His paper on roadmap to reopening suggested that around 750,000 tests needed to occur each week in the United States. So proportionally, that would be about 86 tests per day in McLennan County. And right now, we're pretty close to that. Harvard put out a roadmap to pandemic resilience, and it suggested a much higher number. And so I think we're beginning to build a range of what the minimum number is, and then what is what's ideal, and then what would be unnecessary or excessive. We've looked at the White House guidelines and compared them with the other guidelines that are available. My own conclusion is that really there are a couple of factors that are important to answering this question. One is the prevalence, as best as can be estimated, the prevalence in the community. And the other is the degree of risk in the human behaviors in the community. So if prevalence is low and risk is low in terms of the human behavior, then testing does not need to be really, really high. But as we begin to take certain strategic risks in terms of our collective behaviors, we will need to increase testing in order to be able to capture changes in the spread of the virus when those changes are early. Because as we've explained, and as I think most who are listening understand, in terms of the spread of the virus, it doesn't happen in a steady, linear way, but in an exponential way. So the virus blossoms out very quickly when we lose control of the spread.
Okay, following up a little bit about the testing, is funding a major setback in attaining more tests?
Dr. Griggs, I'll ask you to address that one too, please.
Yeah, thanks. Yeah, not that we've identified right now. Reagent availability, laboratory capacity are the limiting factors, and I think it's nice to report good news in that a lot of the earlier barriers have been relieved. So our capacity, and I can speak only, I think, about the Family Health Center in detail, but our capacity to do tests has expanded quite a bit. So we are also changing our criteria to accommodate more of our patients who have symptoms that may indicate COVID-19. Historically, it was just vulnerable patients or patients with close contacts. Now, our patients who have any symptoms that may suggest COVID-19, we are testing.
Okay, I think you've already addressed a little bit of this, but the next question that was presented to us, McLennan County has seen 78 COVID cases in 90 days. Based on information you have, how has McLennan County, has it reached the peak for the number of COVID cases?
Dr. Griggs, I'll ask you to take that one also, please.
Yeah, as far as we can tell, we have mapped very closely in proportion to the Texas cases, and so while we have small numbers and you need big numbers to run predictive analytics, we have just small numbers, but we can track the number of cases as they relate to the predictive numbers in Texas, and those have been on the same curve. So we think that we have reached our peak as well with, again, this current wave, and since if we look at 6-day rolling averages of cases, we have had a steady decline since early April.
What is the level of pushback you've received in keeping the city and county shut down past April the 30th? Any protests planned?
Judge Felton, would you start with that?
I have been in discussions with numerous types of businesses, primarily about most of them are, I'd say, all of them very positive conversations about how they can best and safely get back into business. Retailers, Restaurant Association, Texas Restaurant Association sent me some information that is very helpful and understanding, and I think the mayor received that as well. Calls from retailers figuring out exactly how to set up how they would allow people to shop, but yet do that safely with social distancing, and of course the one that all of them bring up that's very important is cleaning surfaces and decontaminating areas in restrooms and places like that. So I think people are ready to go, but they don't. They are very serious about taking responsibility and making sure they're not part of the problem, but yet the solution.
I would just add to that. I do receive phone calls and emails on a regular basis from folks, and some are very frustrated with not being able to reopen yet. There's no question that there's a lot of pain in the small business area, especially I'm hearing a lot from hair salons and those kinds of businesses that are you're in such close contact in those settings that it is not going to be time to reopen them in this first set of openings, in my estimation. But again, that may be up to the governor and not to us. But I would agree with the judge that the vast majority of the calls and emails that I get are just trying to figure out safe ways to move forward with this, and that's exactly what we're trying to do as well. And then I've not heard anything about any possible protests or anything like that.
This next question is kind of centering, I think, around tourism, as it may be. What date has been discussed with the city for reopening the silos?
Well, I can address that. We don't have a date that has been talked about with silos for reopening. I want to mention again that Magnolia took the proactive step for the safety of their employees and of all the guests of closing the silo market before they were required to do so. And a number of our businesses that were non-essential type businesses took that proactive measure. And I think that's another reason that we've had good success here in McLennan County. But the silo businesses would reopen on the same kind of schedule that we would roll out for similar businesses. And that will all be based on data, not so much on a date.
Okay. Do you anticipate exemptions or adjustments in property tax rates or valuations as a result of the pandemic?
I would say that property tax values are really that's the work of the appraisal district, not of the city or the county. So I think those questions might be better asked of them. I will say that one thing that we are working on, the city together with the county, is a small business relief program that would be for very small businesses, kinds of businesses that struggle to meet the requirements of the PPP loans. That program is still in development, and we're trying to find sources of funding for it. But we hope to be able to announce more about that in the coming days and weeks.
Judge, did you have a comment about county taxes or anything else, or you want to?
Well, no, I mean the same, and there are programs out there that we support. There's state programs, but also, as the mayor mentioned, we have a local program as well with initial funding in it, and we hope to be able to bring attention to that so people can apply for it.
Okay, shift back to the governor a little bit. He's announced plans to restart or reopening Texas. Does the city and county have any plans or a team working on local reopening plans?
Judge, would you start with that?
Yeah, well, yes. I mean, we have a group at community collaborative working teams. These folks that are on this team, they represent different parts of the county and also different industries and different business backgrounds, and so that's our approach. Folks that we know that have a long history of making good judgment and very community minded to be able to advise the county judge and the county commissioners as well as the mayor and the city council.
I agree with that, Judge. That's exactly right. And of course, we will continue to put health and safety first, but we are listening hard to the business leaders in our community, and we are relying on these community collaborative working teams as sort of the main source for that. But we're also talking to other business leaders and other health professionals, including, of course, Dr. Verner, the health authority, and Dr. Gray, the director of the health district.
And academics or folks are also involved in it to help us sort out the data.
Exactly.
Speaking of data and things like that, what kind of specific benchmarks do you think there are, and maybe y'all are monitoring, that affect the ability to reopen?
Well, again, a lot of this is going to depend on where we stand with the governor's orders. But we are working out a plan locally in case we have some degree of local control. We want to be ready for that. And so the plan that we have begun working on is sort of based on the president's plan that was laid out by Dr. Fauci and Dr. Birx, that has these gated approaches to having to have certain health metrics met, and then opening one phase of businesses and activities. And then if you can stay in the green for 14 days, have a continued improvement or at least a flattening, then maybe you can go through that next gate and open up more businesses and more activities, so that you take a slow approach. And the 14 days is important because it takes about 14 days to be able to see the data from the testing to see what impact any changes you've made in social behavior have had on the disease.
Okay, there's a term floating around that people need to figure out what it is. What is R naught? and why is it important?
Dr. Griggs, I'm going to let you take that one.
So the R naught, it's indicated by an R and then a little 0. And R naught is the basic reproductive number. It's something that's used in epidemiology, infectious epidemiology, to indicate one contagious person, how many others are they likely to infect. So if you had an R naught of 1, it would mean that one contagious person infects one other person. The seasonal influenza flu has an R naught of about 1.3. Our early studies related to the novel coronavirus had an R naught of around 2.2 to 2.7. The CDC on, I think it was April 7th, looked at numbers in Wuhan and published that the R naught for the novel coronavirus was 5.7, which is, in terms of infectious disease, is very, very high. So very high contagion of this virus. There's a related term, an idea, which is the RT, little t. So, and that's the effective reproductive number. The effective reproductive number is, at any point in time, understanding, based on human behaviors, how contagious is the germ. So an RT is something that we have an impact on. The effective reproductive number can be changed by sheltering in place or restrictions on people getting together in groups, on economic restrictions. So the RT, if we can keep the RT, or the effective reproductive number, less than 1, then one individual is less likely to pass on that infection to another individual. So keeping the RT less than 1 is the goal. And in Waco, in McLennan County, we're on I-35. We're connected with the rest of the world. Having 0 case incidents is a bit of a fantasy, because we're always going to have new cases arriving in Waco and occurring sporadically. But if we can work to keep RT, the effective reproductive number, less than 1 through our behaviors, then we can keep that infection from ballooning out again. We're of course right now stuck between competing goals of economic prosperity and human safety, and I think it's certainly not lost on any of us that economic prosperity is related to human thriving and health. And so we have short-term health needs and we have long-term health needs, and those long-term health needs we recognize are impacted by economic deterioration. So the balancing act is really critical here. Keeping RT less than 1 will allow us to begin to change our behavior in ways that as long as we can monitor this figure, we can begin to make some changes in a helpful direction. The problem is, though, that it takes big numbers of cases in order to be able to calculate the effective reproductive number. So we can calculate that for Texas, but calculating it for McLennan County is, again, we don't have a high enough number of cases to be able to calculate that. So there is a website called rt.live. It is offering the RT, the effective reproductive number, for the state of Texas compared with all the other states. So I would just suggest going if you're interested. And that's put together by, I can't remember his first name, last name is Systrom. He's one of the co-founders of Instagram, a computer scientist, very smart guy. So anyway, he's helped lead that effort in getting the effective reproductive number available for all the states.
Okay. I know everybody's excited about the potential of opening and starting to be able to do things as business. Question is, will we be required to wear masks?
Judge Felton, would you take that?
Okay, we do not have a requirement to wear masks, although we strongly recommend it if you're going to be in an area where there's a high concentration of people or people from outside your family group there. And from time to time, you have to go to the grocery store, you have to go to Home Depot or those kind of places that are essential businesses are still open. And although they have rules about social distancing, many times it's hard to get in there and even though you're trying to social distance, the next person's not paying attention, and it's not so. The CDC recommends that even a simple mask can give you some protection, or it actually protects the other people in case you're infected. So even a simple mask could be of help when you're in areas like that. But the best rule is social distancing for sure, even more so than what the mask is.
Yeah, I agree with that, Judge. Thank you.
Okay. After you've gotten a clean test, what about retest? As it could be infected the day after you had the test. What about a retest?
Dr. Griggs?
Well, we don't know much about immunity to this virus, but we do know that other similar coronaviruses, humans do develop immunity to those viruses. So obviously we're very, very hopeful that that same applies to this virus. There is some early evidence that a very small percentage of the population has a delayed immunity and so may shed the virus much longer than others. But it's probably still too early to comment in detail on the science there. But there's information that's coming out on a rolling basis right now from the medical literature that we're tracking.
There's reports that some tests are coming up with false positives. Aren't there problems sometimes that most available tests maybe have a false positive or a false negative?
Dr. Griggs?
Yes. Among those who actually have the virus and who truly have the virus, the test seems to say that the person has the virus about 70% of the time. Now, if the test says that a person has if the test says that the person has the virus, then it is true almost 100% of the time. So imagine coming into a clinic and having a fever and getting a test, and the test comes back positive. Well, you can hang your hat on the fact that you have the coronavirus. The problem arises when in areas of low prevalence, so you don't have a lot of the disease circulating in the community, and somebody has symptoms like a little bit of sneezing, a little bit of sore throat, maybe an occasional cough, and they go in and they get tested. And the test comes back negative. So because there's low prevalence, that negative test is still likely to be telling the truth that you don't have the virus, but that's again because to start off with, there was such a low chance that that individual had the virus in the first place. So the fact that we are right now in a low prevalence period of time, a negative test is likely to be telling the truth. But among those who do carry the virus, if the test is taken, it can be wrong. If it's negative, it can be wrong up to 30% of the time. So that's the problem with the test. We think in terms of the negative predictive value, which is a related idea. Right now, the negative predictive value of the test is very good. In other words, if you get a negative result, you probably don't have the coronavirus. But that's because the prevalence is so low. If the prevalence is very, very high, if there's lots and lots and lots of coronavirus in the community, and you get a negative test, that's when it becomes more problematic because you don't know for sure if you're negative or not. Why we say that if you still have symptoms, that you need to continue self-isolation though. Even if the test comes back negative and you are having fever, dry cough, shortness of breath, related symptoms, still need to self-isolate.
Kind of on that same. Go ahead, Mayor.
Follow up on that real quick. I think one of the places we're hearing about false positive tests is an antibody test, which is a whole different animal that we don't have available here yet anyway, correct?
I think that the antibody tests are just beginning to come online for the community. I mentioned this at last week's press conference, so I won't go into great detail, but their antibody tests are in two different types, IgM and IgG. IgM essentially just confirms that somebody has the coronavirus, and it appears positive after 5 to 7 days. It's a blood test. It is about as good as the swab test. That's the PCR that we've been using. The IgG test, also a blood test, may indicate that a person is immune. We think that it does, but we don't have real confirmation yet in the literature that an IgG that's positive, which would only show up about 2 weeks after symptom onset, that IgG, if it's positive, it likely, but shows that a person is immune, but we're not 100% confident about that yet.
Do you think...
And that does have... Yeah, go ahead.
No, I was going to say, do you think there's a large number of unreported or undiagnosed COVID cases in around the area?
In an area of low prevalence, a large number, probably not. But my worry is that there is literature that has come out that's been fairly clear that particularly in young young adults and in people who are otherwise healthy, that asymptomatic cases are occurring at a fairly high rate. So the New England Journal last week published a report about in a maternity ward in New York. They did universal screening, universal testing using the swab, and 15% of the women coming in to the hospital were positive. But among that 15% who came in, 88% of that group didn't have any symptoms at all. So again, 88% of those who tested positive, and this is a young women who were coming into maternity ward, 88% of those who were tested positive had no symptoms. So that's concerning.
This question did not come from me, so I'm going to define it the way it is. What is herd immunity? Hasn't someone suggested that we should let everyone become infected with the virus to build herd immunity?
Dr. Griggs, I'll ask you to take that one too.
Okay. Herd immunity is the idea. It doesn't relate to an individual's immunity. It relates to the whole group. So the notion of herd immunity is that there are enough people in a community that have immunity to the pathogen, the infectious pathogen, in this case a virus. There are enough people in the community that have immunity that the virus can't hop from person to person to person. And so if somebody does have the virus, when the rest of the, or an adequate number of the rest of the herd is immune, then after that person gets the virus, they can't spread it throughout the rest of the herd. So this is why we're anxious about a vaccine someday for this coronavirus, because then when we all get vaccinated, then this virus can't hop from individual to individual to individual because there's herd immunity.
Okay. Scientists have said that COVID-19 is adversely affected by heat and humidity. What about that?
Dr. Griggs, why don't you take that too, please?
So National Academy of Medicine wrote a brief on this. They reviewed the best science and wrote a brief on this. I think it was actually addressed to the White House. But what the best science shows is that in a laboratory, increasing heat and humidity does make the virus less likely to replicate. In the real world, though, there are so many other factors that seem to be far more important or influential about spread that we by no means should hang our hat on. Well, it's about to be Texas summer, and this thing's just going to evaporate. We have not seen, with other coronaviruses, we have not seen a seasonality of it. So with MERS and with SARS, we did not see heat and humidity make major impacts on those viruses.
You've answered this one before, I know, on other occasions, but I'm going to repeat it because I think it might need a little more detailed explanation. Who specifically is the most at risk to COVID-19? 65 plus, diabetics, heart patients, liver patients. You've talked about defining the underlying health. Who are the elderly?
So in China, 80% of the deaths were in adults older than 60. In the United States, the data to date indicates that 80% of the deaths are in adults greater than or equal to 65. I have some figures here that I can share, and this is from the CDC, and this is helpful because by age strata, by age group, it gives ranges of mortality. So it allows us to kind of think about risk and who's at most risk. So 85 years old and older, the mortality range is 10 to 27%. 65 to 84 years old, the mortality range is 3 to 11%. 55 to 64 years old, the mortality range is 1 to 3%. And less than 55 years old, the mortality is less than 1%. So that assumes that, that we're taking a cross-section of the population, so we don't take into consideration any given individual's number of chronic diseases, comorbidities. So that's cross-sectionally what we see through the community. But we also know that any given individual who has chronic disease is more likely to experience serious illness or death than someone who is that same age who does not have chronic disease. So let me describe the chronic diseases that have been studied so far that are related to severity of risk. So that's diabetes, hypertension, COPD or emphysema, chronic obstructive pulmonary disease, COPD, emphysema, coronary artery disease, so cerebrovascular disease, that's stroke, chronic kidney disease,